The overwhelming odds are that your child suffers from one of these unhealthy medical or social conditions. In fact, 9 out of 10 kids in America are experiencing one or more of these problems every day. They seem to be totally random with nothing in common. However, research over the past 20 years has linked each of these conditions to a common cause. Children's sleep disorder breathing, SDB, is a physical disorder that causes disruptions in a child's sleep pattern. Sleep disorder breathing causes a reduction in the amount of oxygen that a child's body and brain receive during sleep. They don't get the kind of restorative sleep that a growing child needs, and they end up being chronically tired. Children's sleep disorder breathing has also been linked to adult problems such as migraines, heart disease, chronic cracked and broken teeth, and TMJ disorder. What exactly is children's sleep disorder breathing? There are 2 kinds of sleep disordered breathing. One type involves the airway in the child's throat, and the other involves the nasal airways. Kids play hard and get exercise when they do. However, the first kind of SDB that involves the airway in the child's throat comes from the tongue and lower jaw not getting enough of a workout in the first 5 years of the child's development. To illustrate this problem, think about a boy who has broken his leg. A cast is put over the leg to keep the muscle and bone as still as possible. However, the old saying, use it or lose it, comes into play here. From the very first day of casting, the leg muscles and bone begin to shrink and get weaker. That is why the doctors get the leg into a walking cast as quickly as possible. The pressure of walking reminds the leg that it still has a job to do and stop the atrophying. The same thing can happen to a child's developing lower jaw. Many parents wean their child onto soft and pureed baby foods. However, mushy baby foods don't require the child to chew. The tongue doesn't have to move things around to position food for the teeth to chew, and the jaw and teeth have nothing to bite, dice, or grind. That tricks the child's developing lower jaw and tongue into thinking that they're not needed, just like the leg cast tricks the leg muscles and bones into thinking there is nothing to do. The jaw and tongue don't grow, and may in fact shrink while the rest of the head continues to grow normally. The face takes on a distinctive receding chin look, as the lower jaw and tongue don't keep up with the growth of the rest of the face. This is an actual patient's x-ray at 8 years of age. Notice how the tongue and jaw are constricting the airway because the lower jaw didn't grow forward enough to keep the airway of the throat open? The child may be able to breathe well enough when upright. However, lay the child on his or her back to sleep and you've got a problem. The muscles of the throat relax and shut down the airway even more. Just like adults with obstructive sleep apnea, children may stop breathing for several seconds at a time or even longer as they sleep. Now let's talk about the second type of sleep disorder breathing. Children with obstructed nasal airways usually sleep with their mouths open as they try to compensate for the diminished airflow through their noses. Do you see the problem in all of these photos of mouth-breathing children? That's right. All of their tongues are laying on the floor of their mouths. Well, of course they'd have to be. If their tongues were pressed against the roof of their mouths, no air would be able to come through. So the tongue has to stay locked to the floor of the mouth, and that's a problem. You see, as soon as your newborn began nursing, the tongue began doing its most important work. Within days of birth, the tongue begins to shape the structure of your child's mouth and protect the nasal airways. You may ask, what do you mean, protect the nasal airways? The cheeks and lips are powerful muscles, and they are constantly contracting and squeezing. That continual pressure squeezes the upper jaw together and pushes the roof of the mouth upward. If the tongue is living in the roof of the mouth, it counteracts this damaging force by pushing outward. A delicate balance is maintained. However, if the child's a mouth breather, the tongue isn't up in the roof of the mouth doing that job. It is critical that the tongue lives in the roof of the mouth. Only there can it provide the force and leverage to properly develop the child's oral and nasal and facial structure. Sometimes it isn't mouth breathing, but rather genetics that causes the problem. The child may have been born with a tongue tie, where the frenulum, that little flap of skin under the tongue, is holding the tongue down. In this case, the tongue is being physically prevented from protecting the nasal airways. Luckily, this is easily treated with a quick procedure at the dentist's office. How does a child become a mouth breather? In today's world, children often get a 1-2 punch in the nose, so to speak. The first punch comes when a child develops cold after cold or one sinus infection after the other. This causes them to breathe through their mouths while sleeping. As we found out earlier, that allows the cheek and lips to squeeze the upper jaw and push the upper palate into the nasal airway. Then, when the child wakes up, the second punch hits them in the mouth. Widespread use of pacifiers and bottle nipples in the modern world is a relatively new problem for children. Wait, what? Bottle nipples and pacifiers cause sleep disorder breathing? Let me explain. In this illustration, the red circle represents a bottle nipple. As the child sucks on the nipple, the tongue presses it into the roof of the mouth. The roof of the mouth is then pushed up into the nasal airways, making it smaller and smaller. And if that's not bad enough, the action of sucking draws the cheeks and lips inward, which squeezes the upper jaw further, pushing the roof of the mouth upward into the nasal airways. As the nasal airways shrink further, the child begins to mouth breathe both day and night in order to keep the flow of oxygen going. When the child mouth breathes, the tongue lays on the floor of the mouth, where it cannot prevent the lips and cheeks from squeezing the roof of the mouth up into the nasal airways. The nasal airway continues to shrink as they sleep. When they wake up, they spend hours every day sucking on pacifiers or bottle nipples. The roof of the mouth is pushed up and the nasal airways are compressed even more. The child has to mouth breathe even more just to provide enough oxygen during sleep. It becomes the perfect example of a vicious cycle. You're probably thinking, why didn't anybody tell me this before? And I can't go back and change the past now. Well, the truth is that much of this information and the connection between children's behavior and social problems and sleep-disordered breathing wasn't confirmed until relatively recently. However, I have good news. While it may not be possible to go back and change the past, we can now go forward and change the past. When treated early enough, the damaging effects of baby food, pacifiers, bottle nipples can all be undone. In fact, in most cases, it can be totally reversed. A qualified sleep dentist can now offer a program of treatment which will not only stop, but actually reverse the damage done to your child's airway and to the child's facial structure. It's called guided growth, and it can bring health, well-being, and a happier life to your child now and in the future. Guided growth is a do-over program for kids. Guided growth uses oral appliances, nutrition, oral exercises, and palatal expanders to allow facial and oral structures to catch up to normal. Remember the profile of that 8-year-old boy with a receding chin? Here he is at 13 years of age, after following a guided growth program from his dentist. His facial structure has been brought back to normal development for his age. Now let's see if the therapy has opened his airway. The boy's airway has been opened by moving the lower jaw forward, and his facial structure has been restored to normal. How do you know if your child has sleep disorder breathing? There are common signs of SDB. Crowded teeth. The child's teeth don't have enough room to come in naturally. Noisy breathing. Breathing through the nose is like sucking a malt through a flat straw. Noisy. Swollen tonsils. Mouth breathing does not warm or moisten the air. The tonsils and adenoids can become chronically dry and irritated. An overbite or receding chin. The constricted tongue is pushed back into the airway. 24/7 mouth breathing. The child breathes through his or her mouth both day and night. If you suspect that your child may have sleep disordered breathing, call our office for an evaluation appointment. The sooner that we start treatment, the sooner your child can start living a normal and happier life.